Hello people, in this video let us look at this question. Classify fibrous joints with examples. So under joints, you have fibrous joints. They want you to classify these fibrous joints with example. Okay. So now let us get started with this. Asked only for 3 marks, so you won't be spending much time. Asked in this particular exam, anatomy final exam of April 2023. Okay. So let's directly get into the point because it is only for 3 marks. You should write within like 3 minutes, like I would say. Um, go here. Yeah, so under joints, you have fibrous joints, cartilaginous joints, and synovial joints. What have they asked in the exam? Only the fibrous joint classification. So under fibrous joint also is called a synarthrosis. These are immovable or very slightly movable. These have between the bones, what is there? Fibrous tissue. What is there between the bone? The fibrous tissue is there, and this is not fibrocartilage. Okay, that's what I'm trying to say. If it was fibrocartilage in the middle, it would have become what? Cartilaginous joint. But here it is fibrous tissue. So it is fibrous joint, immovables or very little movable. Okay, now what is the classification? There are 3 types of fibrous joint. You have the suture, you have the syndesmosis and gomphosis. What do you have? What are the 3? Suture, syndesmosis, gomphosis. 3 words you wrote. Example, suture. Suture, you have so many like plain suture, serrate suture, so many types are there. We'll come to that. But where do you see? You see it in the skull. Okay, you just say skull. Specifically, you can give examples, but we will come to it. Then syndesmosis, where do you see what is actually there between 2 bones? Here you have interosseous ligament. What do you have? Interosseous ligament. Now, where will you see this? Between the radius and the ulna, or between the tibia and the fibula. Very good. So this is syndesmosis. Then last you have the gomphosis. Gomphosis, where will you see? You will see between the tooth and the bony socket. So the tooth shouldn't move, isn't it? So that is a fibrous joint. So you wrote 3 words in the classification and 3 examples. You should be hopefully getting marks. Now, in case that person was interested in little more or he asked for 5 marks, then you can say that fibrous joints are formed by what? Fibrous tissue. We already told you this. Then these are immovable or they permit slight degree of movement. Now, this has 3 subtypes. The first one is what? Focus people. Suture. Now, where do you find suture? In the skull. Okay. Now, in this you have plain suture, serrate suture, squamous suture, denticulate suture, and skin dialysis. Okay. So, what is plain suture? Look at this diagram here. This will be useful. Plain suture means what? In the middle, it's a plane. So simple. What is serrate? Serrate will be something like this. What is squamous? Squamous is something like this. Okay. Then what is denticulate? Like this. Okay, this is denticulate. Then you have them some skin dialysis. This is very difficult for me to understand. Wedge and groove. Wedge and groove. Something like this, I would say. Okay. Now look at plain suture, internasal. Look at parietal bone. Between 2 parietal bones, you have serrate suture. And between the temporal bone and the parietal bone, you have the squamous suture. Squamous suture is something like this. Let me just remind you what squamous suture is. This is squamous suture. That's all they're saying this is. This is squamous suture. What is so squamous about it? What is the meaning of squamous? It's the flat portion of temporal bone itself. Anything flat, that's why they are saying. See, epithelium and all flat. Next you have denticulate suture or lambdoid suture. If you still remember what denticulate is. Something like teeth projections one will have, right? So let us say like this. Something like this, okay? And the other guy will have exactly the other way to allow these projections to sit inside. So this is denticulate. So something like this now you should be able to see, okay? I'll show you a diagram. Ready? Denticulate suture where? Lambdoid suture. Is it like that? Yeah. The other guy is giving space for all these projections type. Yeah. So this is the Lambdoid suture. So lambdoid suture, where do you think it is? This is parietal bone, this is parietal bone. Which is this bone? Occipital bone, isn't it? Only one more word is remaining, right, in the sutures type. Do you know that complicated word? Shindylisis type. This is between the rostrum of sphenoid and the upper border of vomer. Look at this. Some wedge type, they are saying, okay? So some sphenoid and vomer have this shindylisis. Okay, it's very complicated, right? Yes, yes, very complicated. Now let us go back to this explanation that these people are telling why we have so many sutures in the skull, because in neonate what happens, that is basically a fetus, all these are bones are not totally fused, right? Once the newborn is delivered, so once the fetus is delivered via the molding process, etc. So then once the baby is delivered, then these what do you say, bones actually fuse and they become immovable, right? I thought it's for delivery purpose, but looks like here they are saying that it allows the brain to increase in size. That is why there are gaps also between these bones. Okay. So that becomes the clinical anatomy for you. Fontanelles. You'll have to know anterior fontanelle, posterior fontanelle, all these fontanelles you'll have to know. Okay. How many are there? There are 6 specific points on the sutures that are filled gaps called fontanelles. All fontanelles become bone by 18 months. 18 means what? 1.5 years, correct? Now let us move on, people. We focus so much on suture. Now let's go to syndesmosis. Syndesmosis. So where is it? Between your, let me put a right hand here, otherwise it will become difficult for me to understand. This is the right hand, and here you have the radius, and here you have the ulna. Between the radius and the ulna, you have an interosseous ligament. What is it? Ligament. Interosseous ligament. Don't say membrane. Okay, they're saying using the word ligament. So you also use the word ligament. So this is connecting the bones. Okay, this is also there between your tibia and fibula. Inferior tibiofibular joint. Okay. Next, last one. Last one, what it is, if you say, yeah, gomphosis. Very good, very good. Gomphosis. So it is also called as peg and socket joint. So there is what socket? There is a bony socket, and who is the peg in that? The tooth. Okay. So you have understood the classification of fibrous joints with examples. Okay. Sutures, syndesmosis, gomphosis. Bye bye.